To a rough start to the new year for one of the business world's most famous figures, Jeff Bezos, the founder and CEO of Amazon, had to be helicoptered off a cruise ship when he experienced a medical emergency while on vacation in an exotic location. ABC's Aditi Roy is following the story from Los Angeles. Aditi.
Good morning, Bianna. Ecuadorian officials say the kidney stone attack happened on New Year's Day while Bezos was vacationing on a cruise ship. The Navy quickly responded and choppered Bezos to a private plane, and that brought him back to the States. Ecuadorian Navy officials say they evacuated Amazon founder Jeff Bezos from a cruise ship on New Year's Day after the billionaire suffered a kidney stone attack while vacationing near the Galapagos Islands. According to the Navy, Bezos was on a cruise ship just off the coast of Santa Cruz Island when it happened, with Bezos' plane waiting 20 miles away to fly him back to the U.S. The cruise operators radioed for help. An Ecuadorian naval chopper was scrambled to airlift Bezos to the runway on Baltra Island.
They went to great lengths to make sure he was okay. And I think a lot of that has to do with who he is. He really is a titan of industry.
An Amazon spokesman says Bezos is doing well. Bezos made headlines last month when he told CBS's 60 Minutes Amazon is experimenting with drones that would deliver packages to your home.
You give them instructions of which GPS coordinates to go to, and they take off and they fly to those GPS coordinates.
While Bezos had to rely on more conventional air travel to get medical help, he did issue a tongue-in-cheek statement through a company's spokesman, saying Galapagos 5 stars, kidney stones 0 stars. And that's a nod to the company's star rating system for products, of course. Kidney stones are not usually life-threatening. It's nice to see him having a sense of humor about it. Dan and Bianna.
But we know they are extremely painful. Aditi, thank you. Yes. And here to talk more about the cause and treatment for kidney stones, ABC's chief health and medical editor, Dr. Richard Besser. Passing a kidney stone can be excruciating, as we know. The pain said to be worse than childbirth for men. What is Bezos likely going through right now?
I mean, I feel for the guy. So kidney stones, when you have solid material that's forming in your kidney or elsewhere in your tract. Some of the small ones you can pass on your own, but a large one, it's excruciating the kind of pain that people experience.
This whole conversation makes me want to go in the fetal position. What can I do and what can men do to avoid this?
Well, you know, if it runs in your family, there are particular types of stones. They may want to put you on a special diet. There are certain medications that people will go on. They're going to want you to increase the amount of fluids that you take in. Kidney stones are pretty common. About 1 million visits to doctors every year. 1 in 11 people have these kidney stones, so it's a common problem. If it runs in your family, you want to pay attention to it.
But is there anything just basic you can do, basic preventive work in terms of your diet? Nothing too extreme?
Not really. You know, they form when your urine gets really concentrated. So everyone making sure that they're drinking additional amounts of water, that might help. But unless it runs in your family and you know the particular type, if you have a kidney stone, the doctors are going to want to analyze that stone and see exactly what type it is, and then there may be certain foods that they ask you to avoid to prevent this from happening.
Doc, I can't talk right now because I'm
water is definitely important, but you know, men compare it to childbirth. Not that they've ever given birth, but I think doctors would confirm that as well. And there's no epidural that men can take when they're going through this pain.
No, they'll give you IV fluids to help pass the stone. They'll give you strong pain medications, but it's that pain when you're urinating is one of those symptoms. You may see blood, the pain in your lower back or in the center of your back, nausea, vomiting. Those are the signs of a kidney stone, and if you have that, you're not going to avoid it. I mean, you're not going to ignore it because it is debilitating. I mean, I don't know the pain of childbirth, but seeing people in the pain of kidney stones,
people that have had them. Yes, it's painful.
It is really, really debilitating.
Folks at home, if there's no other reason to drink a lot of water, it's to avoid kidney stones.
Yes,
nothing else.
I'm going on an IV for the rest of the morning. Dr. Besser, thank you. We appreciate it.